Hello, this is Optimum Health for All. I'm your host, OJ Odor.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today we are talking about common dental disorders, diseases of the teeth. And this is very important because the teeth reflects the personality of the person, whether the teeth is healthy, is white, and so on. And then sometimes odors come from the mouth based on poor dental hygiene. So today we want to talk to an expert on dental diseases, Professor Olufemi Omitola. Professor Omitola, you are welcome.
Yeah, thank you very much, sir.
Now we just talking to the areas on how to take care of their teeth. So let's start with common dental disorders.
So,
And then how do we manage them?
okay, sir. Thank you very much, sir, for inviting me. Today, we'll be talking about common dental disorders, like he has said. We'll look at the three most common dental disorders that we have, so that because of our time, we talked about one, dental caries, then periodontal diseases, including gum diseases, and then we'll talk about poor and bad mouth odor. Those are probably the most common that we see around. I will start with dental caries. Dental caries simply means hole in the teeth. For a general person, hole in the teeth. You are wondering, the enamel is the hardest substance in the body. Why is it that hard substance will eventually have hole? The reason is not far-fetched, because enamel is hard because it contains inorganic material. And then when you allow acid to come in contact with inorganic material, it will leach out those inorganic material from enamel and make it to be weak and leading to hole. So how do you get acid into the mouth? The way acid comes into the mouth is this. When we eat, we have what we call normal flora. That's organisms that stay in the house. That's their house. There's nothing in the mouth.
Yeah, they live
there. There is nothing you can do about that. So they live in the mouth. We call them normal flora. And when you eat and you leave food particles is left in your mouth, what happens is that those organisms act on those food particles to generate the acid. So when you have acid batting the tooth, then it will gradually be removing those inorganic material from the tooth, and with time it will lead to hole. So the longer you have exposure of acid with the tooth, then the higher the chance of having dental caries. So when you have that understanding, then you also understand how to prevent it. The way to prevent it is to stop that exposure. One, the organism, you cannot remove them because they are beneficial to us too. So you cannot say you want to remove the organism, because if you remove part of an organism, bacteria which is responsible, you allow other organisms to begin to grow, and that will lead to problems. So there must be a balance.
Yeah.
So, but what we can do is to prevent them having access to that substrate, which is the food particle, and that's why we always advise that you brush your mouth 2 times a day. Yeah. You brush after breakfast in the morning. I know that most of us like to brush first thing in the morning.
Because yes, to make your mouth feel better. So your mouth is
summer. Yeah. So it's because we are not be brushing before sleeping. So we advise that we brush after breakfast, and lastly before you sleep.
So before you sleep,
you brush.
Last thing at night.
Before you brush your teeth. Yes, you know you are not going to eat anything again. You brush your teeth and then go to bed.
That's a good recommendation.
So when you do that, by the time you wake up in the morning, you find that your mouth will be a bit fresh, and then you can. But because we are used to brushing early in the morning, fine, you can brush that, but make sure you also brush after, or at least rinse your mouth thoroughly, so that we can dislodge the food particles. And then once you do that, you cut off the organism from being able to act on anything that is left over, and then you now have,
that will prevent dental caries.
Prevent dental caries in the teeth. So the second one that we'll be talking about is gum disease and periodontal disease. Periodontium is the support of the teeth. They are the one that support the teeth, and it consists of gingiva, consists of periodontal ligament and the bone. But
that's what holds the
teeth in place. Yes, they hold them in their socket there, so that the tooth will be firm. But when you allow problem to accumulate around it, for a long time, you have destruction of the bone, destruction of the soft tissue, and the tooth become shaky.
That's okay.
Yeah,
That's why it can fall off.
Yes, food can begin to fall
Okay.
off. There is just general belief that as you get old, tooth should fall off. It's not true.
That really is
It's
because
not
when
true.
you grow old, at 70 or 80, you should not be having your
No, it should not. So we believe that, but it's because we have not been taking good care of the periodontium. So if you don't take care of them, you lose them, and then you eventually will lose it too. So what you need to do is that you make sure that, like I said, the organisms are there. There's nothing you can do about that, but you can reduce the load of the organism by making sure that you clean your teeth regularly, as I said earlier on. And also, no matter how you clean with brush and toothpaste, you cannot clean in between two teeth. Your bristles will not enter. It will not enter. That's why we recommend that you should come to the dentist once every 6 months, so that the dentist can help you remove anything that is left.
Twice a year.
Yes, twice a year. Yes, so that they will remove everything that is left, and then they also take advantage of looking at your mouth. If there's anything that is starting early, like the caries I mentioned earlier on, if it's starting early, they can stop it at that stage before it gets to problem.
Feel it.
You can feel it, yes, because at the early stage you can feel, but when it gets to a very long, prolonged end stage, you can no longer feel. So when you come, they will clean like that, and it's very cheap. And it's even covered by NHIS. So once you have NHIS, you can do that every 6 months, and then they will remove anything that is left in your mouth, and then the gum will be healthy, and you will not have problem with your gum. And then another thing that I want to talk about is the mouth odor. Mouth odor can come as a result of problem in the mouth or outside the mouth. Outside the mouth, maybe other parts of the body.
It can be from the mouth,
yes,
from outside the mouth.
Yes,
okay.
So
beyond the mouth.
So it can be problem with the respiratory system, problem with the GIT, because all of them are linked together with the mouth. They are linked with the mouth. There is a common. So anything that is wrong inside can be reflected outside. So when you have problem, I will start with the one outside the mouth, because that one is beyond us as a dentist. But at least we need to identify them and refer to this patient. So if you have patient have problem with the lungs, maybe lung cancer or lung infection, have problem in the GIT, maybe you have chronic ulcer, yes, chronic cough and all this. The breath can be coming out and you can feel it. So when such individual comes and we look at the mouth and we are looking at the mouth, there is no problem in the mouth, then we know that this problem is not from here. We advise that such individual, we will look at him, examine him. If he needs to consult a physician, we will refer to that. So once those problems are taken care of, then the person will be okay, and that odor will go. Then the one in the mouth, like we mentioned earlier on, a deep dental caries, when you have a hole in your mouth and food pack inside, even if you brush, you cannot remove it. And naturally, when you have organic mouth, it will be rotten. When it's rotten, it will be smelling. So that might be a cause of problem. Then also, gum disease that I mentioned earlier on, also, we can also cause smelling to take place in the mouth, because when you have problem around the gum and you have bacteria that are working on it, they produce this acid, and they produce these gases, which now come as volatile gases, which you now feel and breathe and everything. So when you have such, what we advise is that you come and we look at your mouth and see. There is also a group of mouth odor that we call psychogenic. That means there is nothing that is wrong with the mouth, but the patient himself insists that the mouth is smelling.
So the other people cannot.
Nobody feels.
Smell it.
Nobody can
feel.
The only one that is the only one that feel that. So such people need psychiatric evaluation, because it's more than like what we had in the conference yesterday. It's a complaint which we should not ignore, but they need the help of a psychiatrist. So when we see such, we work in line with the psychiatrist, and then they will be able to get them out.
I feel my mouth is white. It's not smelling.
It's not smelling. Nothing is wrong, but the mouth is what?
And they feel shy. And they will cover their mouth.
They cover their mouth everywhere they go. In fact, when some of them, if you ask them, why do you think that people feel your mouth is small? You say, when I talk, they turn their head like this. If somebody turn for another reason, they will just attach it to that. So those type of people will need psychiatric evaluation. And when they get their drugs, they are okay. They are okay, and everything disappears. So then, like I said, to prevent caries, you need to make sure that you brush your mouth twice a day, and then see the dentist regularly. And also another thing is that you also make sure that you reduce the number of times that you expose your mouth to food. Especially children, we do snacking frequently.
Yes, they eat.
Oh no, hey, they eat now, they eat another time, they eat another. Yeah. So the more you eat, the pH of the mouth falls.
And
So it gets to a certain level that you begin to dissolve the teeth. So what we advise is that if you want to take snacks, take it along with your food, so that when you brush it off.
Oh, you know that children cannot adhere to this because they want to take. They go to school, they buy sweets, they buy biscuits, and they are eating it all the time.
Yes.
So how do we advise the children, especially those in the early ages, to avoid developing dental caries?
That's thank you very much, sir. No, that's why we have a lot of caries among children. But it's very simple. Like I said earlier on, the main cause is the food particle that is left in the mouth. So if you take anything that you take, just make sure you rinse your mouth vigorously after you are finished taking, so that all those food particles will be dislodged. Once they are dislodged, the organisms are there, they will not be able to cause any harm. So no matter the number of time you take, make sure that you end up by rinsing your mouth frequently.
Thank you very much. Thank you. I think viewers who have benefited, I have personally have benefited from this talk, and this is something that is very important. Taking care of one's teeth, avoiding mouth odor, and so on. In fact, avoiding toothache, because toothache can be terrible when you have aches from the teeth. Can be very very terrible, and we don't want to have all this. So please, all these preventive measures, simple hygiene, simple oral hygiene, brushing teeth appropriately at least twice a day, rinsing one's mouth after eating, and very simple measures can take care of dental caries, can take care of mouth odor, and so on. So thank you very much, Prof.
Thank you, sir, for inviting me, sir.
We are Optimum Health For All. Thank you for viewing. Please subscribe to this channel. Subscription is free. Bye for now.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum Health, you know, but Optimum Health for